Most people get back to normal after pain following an injury or operation, but sometimes the pain carries on for longer or comes on without any history of an injury or operation. It's called chronic pain, and it affects about 1 in 4 American adults according to the CDC. The persistent pain can happen in all parts of the body. Lasting 3 months or more, the chronic pain can be there all the time, or it may come and go. To learn more about chronic pain, we're joined by Dr. Justin Faye, who specializes in advanced pain management techniques and strategies. Thank you so much, doctor, for joining us today.
Thank you. Thank you for having me.
We talk about chronic pain. It's something that's persistent, lasting. It can last weeks, months, years.
Right.
Tell us, who is most at risk for chronic pain?
Currently, I would say more the older population would probably be more at risk than the middle-aged or younger population, but all individuals could be at risk for chronic pain. It's based on lifestyle activities. It can even be based on occupation, who can place you more at risk. Certainly a blue-collar individual would be more at risk than a white-collar a lot of times, but now we're seeing a lot of increase in white-collar chronic pain issues. As individuals may know, working at a desk or computer all day can lead to back pain, neck pain, and joint pain. The overwhelming majority would most likely be low back pain, and then you lead into neck pain. And you're starting to see a lot of joint pain. Individuals that sit at a computer desk all day may have pain in the extremities, especially the upper extremity, but the overwhelming majority is going to be spine-related pain.
So someone comes into the doctor's office and they think they have chronic pain. How do you diagnose it?
It really comes off based off the history portion, drawing out the correct questions or the correct answers from the individual, from the onset to where they're at now, and what they've done in between. It can be anything. Have they attempted physical therapy? Have they attempted medications, injections? Has that improved or has it not improved? And then making that final assessment as far as this is probably most likely what you have as far as chronic pain, and this is what the treatment pathway we should go. And then seeing that patient for follow-up routinely and adjusting to make sure that they're improving.
When it comes to the treatment of chronic pain, there are so many different ways to handle it now. What are some of the keys when it comes to the treatment of the chronic pain?
Yeah, there are a large portion of different treatment options. Most important would be doing the physical therapy aspect, and then lifestyle modifications and exercise. Most individuals necessarily don't want to exercise because it causes a little bit more pain, but there is that, I would say, like a bridge. Once you get past that first week, maybe the second week, you start to improve exponentially.
All right, and I know with medications, we have to be really careful about medications, and I know there are a lot of people in the community who are afraid about substance use disorder or
Correct.
an addiction when it comes to pain medication. So is that something that you all work really closely with the patient on to monitor and make sure that you're treating it properly?
Absolutely, it's something we work extremely closely with the patient on, and we stay within state and federal guidelines, and it's something that we're looking at, say, an opioid or narcotic medication for use. It's not the first line. It's always something that's farther down the line after we tried multiple other treatment options, and then we can say, well, let's go into this spectrum, but we're not going in that spectrum with 2 or 3 different types of medications, one medication at the lowest dose, and then watch the patient very closely throughout that timeline.
And you touched on this earlier about the lifestyle modification that you need to make and that importance of exercise. And I know when you're dealing with like a persistent pain, you don't want to move.
Yeah.
It's the least thing that you want to do, but it's the most important thing that you can do to really get yourself better.
It is. And one of those aspects is simply going out and walking. So you can walk with a loved one, or if you have an animal or a dog or kids, you go out and walk with them. Even to the aspect of, say, pool therapy. If you have a local pool, you can go in there and slowly work into it, just walking in the pool. Other aspects are Tai Chi and yoga. They all have been proven to be very effective. We just have to take that step to do them, and continue them throughout the process.
And don't quit.
Yeah, that's the main aspect. Absolutely.
You'll get through that hump of the pain, and you'll get to the other side feeling a lot better.
That's correct.
Yeah.
That's correct.
How important is that relationship with the physician, with your doctor, and working closely with them?
It's very, very important. So one aspect is you never want to, come to your physician and say everything's okay when it's not. You want to be open and honest, and that comes to a great therapeutic bond between the physician and the patient. But over time, you develop this great relationship, and then you're able to get the patient back into the functional life. And that functional life could be anything from a grandparent hanging out with their grandkids to getting back into the workforce. So we work closely together and fine-tune everything.
So getting back to that functional life is
That's
the
it.
most important thing that we can do.
That's correct.
Alrighty, well, thank you so much for joining
Thank
us
you.
today. We really appreciate your time. And if you would like to learn more about chronic pain, visit the South Texas Health System website.